Okay, so we're in the subacute phase now. We're going to address some global weakness that is occurring. So we're going to be doing some step-ups here. Let's do 5 on the right, 5 on the left. Sound good? All right, so stand up when you're ready. Take a few steps. And then back down. Hold on to the side if you need. You are. Now, if that's feeling too easy, see if you can take your hand off the... There you go. Good. How do you feel? Tired? Do we need to stop? Nope. All right, go ahead, switch. On your way down, try to come down a little slower. Good. And last one. Good. Now, keep facing forward. You all right? Yep. So take little steps back until you feel the chair against the back of your legs. And then ideally this would have armrests, so reach back to the armrest and sit down. Alright, on a scale from 1 to 10, how difficult was that? Pretty difficult. Pretty difficult? Mm-hmm. Okay. We're good.
Alright, so the next exercise we're going to do is a side stepping. In the clinic we could do this in the parallel bars. At home they could practice this at a surface like a kitchen counter, which we're doing here. I'll be having a light contact guard if needed, and I'm just going to have you sidestep to your right and then follow with the left, and again. Alright, and then back towards me. Good. Good. And then see if you can do it without hand contact. Good. Awesome, and back towards me. Awesome.
The subacute phase of MS. So in this stage, we're going to be doing 2 activities to help strengthen the lower extremities and to stretch the lower extremities. We did this in the acute phase as well to just get some measurements, but we want to continue stretching, continue a range of motion so it doesn't affect their gait, as well as strengthening these muscles so it doesn't affect their gait. It overall decreases their fatigue and helps continue their functional activities. So the first one we're going to do is we already stretched the hamstrings in the acute phase. So now we're going to want to stretch other muscles as well that's dealing with spasticity. This is just something they can do on their own, unlike the hamstring stretch, which can sometimes be difficult. So to stretch the quad, we're just going to have the patient bend their knee, straighten this one, and then they're going to grab it with their ankle, grab their ankle with their hand, and just stretch for about 30 seconds. You can feel the pull in the quad. The patient can do this with other muscles in their lower extremity, but this is just an example. This is going to help keep the range of motion and reduce the spasticity. All right, we can do 3 sets of 30. Next, we're going to do a strengthening exercise in this subacute phase. It's just to help keep function. The patient can lay on their stomach. We're going to do a prone hamstring curl. This is something they can do at home on their own with a TheraBand. We're just going to wrap the TheraBand on the lower extremity foot that we're not working out, and then put the TheraBand on the ankle of the extremity that we're wanting to work out. So that I'm going to hold the TheraBand while the patient bends their knee and brings their foot to their buttocks as far as they can, and then slowly lower it down. We started off with a blue TheraBand, which is not as resistant, but with a MS patient, this can quickly fatigue them as well. Slowly lower it down. All right. So you would do this to both lower extremities. Like I said, we're just trying to strengthen the patient and keep them functional as possible.
All right, so I have my patient Anna here. So we're going to be doing TheraBand rows. So what I'm going to have you do is bring your elbows back, keeping them close to your sides, and squeeze those shoulder blades together, and then bring it back forward, slow and controlled. Good. I'm going to do that one more time. Elbows in, chest up, keep this squeezed. Good. And go back. Awesome. One more time. Do a nice hold and squeeze. And back.